Multiple prescriptions for Schedule II drugs. Prescriptions for Schedule II drugs cannot be refilled even though some patients may require Schedule II drugs as maintenance therapy. While there are no federal quantity limits, providers generally avoid prescribing more than a 30-day supply for Schedule II drugs due to the risk of abuse or misuse. The inability to provide refills for patients requiring chronic treatment, like with stimulants for ADHD, for example, necessitates frequent office visits. This can become costly and inconvenient for patients. In 2007, the DEA authorized prescribers to issue multiple prescriptions at one time for Schedule II drugs. These prescriptions can be filled sequentially, but cannot exceed a 90-day supply. The prescription cannot be post-dated. Instead, the prescriber must include 2 dates on each prescription: the date the prescription is written, the issue date, and the earliest acceptable fill date. The prescriber can write any phrase to indicate the earliest fill date, such as "do not fill before," "do not fill until." This is necessary to prevent a patient from filling the prescriptions at the same time at multiple pharmacies. For example, if a patient was seen on April 1st, the prescriber can provide the patient with 3 identical prescriptions, each for a 30-day supply of the Schedule II drug, all dated with the issue date of April 1st. The first prescription can be filled on the day it was written, April 1st of maybe year 2024. The second prescription will include the earliest possible fill date, do not fill until May 1st of 2024, and the third prescription will include the earliest possible fill date, do not fill until May 31st of 2024. Then we look at partial fills. The DEA allows for scenarios in which a Schedule II prescription may be partially filled. Similar to partial filling of any other drug, the total quantity dispensed from all of the partial fills cannot exceed the total quantity that is originally prescribed. So when a pharmacist fills less than the full amount prescribed, he or she must document the quantity that was dispensed on the prescription. The remaining balance must be filled within a specific amount of time or a specific time frame. Otherwise, the remaining balance will be forfeited. There are 3 circumstances in which a Schedule II prescription may be partially filled. The first circumstance is if the pharmacy cannot supply the full quantity. So if the pharmacy can't supply the full quantity, then a portion of the prescription can be dispensed to hold the patient over until the remaining balance can be obtained. So this partial fill could be provided pursuant to a written or an emergency oral prescription. The quantity supplied has to be documented on the face of the hard copy or in the electronic prescription record. The remaining portion must be filled within 72 hours of the first partial fill, and after 72 hours, a new prescription is required. If the remaining portion is not or cannot be filled within 72 hours of the first partial filling, then the pharmacist has to notify the prescriber. The second circumstance in which the Schedule II prescription may be partially filled is this. Under the 2016 Comprehensive Addiction and Recovery Act, or CARA, C-A-R-A, Pharmacists can partially fill Schedule II drugs at the request of the patient or prescriber. This was enacted to help prevent stockpiling of unused Schedule II drugs, which could lead to misuse or abuse. Additional partial fills can only be dispensed up to 30 days from the date the prescription was issued. There is no limit on the number of partial fills that a patient can receive pursuant to one prescription, as long as the total quantity dispensed does not exceed the total quantity that was originally prescribed. The third circumstance is that Schedule II prescriptions can be partially filled for patients residing in long-term care facilities or patients diagnosed with a terminal illness, like if they're a hospice patient. This is to reduce drug diversion and waste that can occur if the patient expires, if the patient dies before the medication is finished. The pharmacist must document terminally ill or long-term care facility patient on the prescription. Partial fills can be dispensed for up to 60 days from the date the prescription was issued. So here are a few scenarios regarding partial fills for Schedule II drugs. So here's the first scenario. The pharmacy doesn't have sufficient stock of the drug, so the deadline to fill the remaining balance is 72 hours. So within 72 hours after they give the patient the first portion of the partial fill, they have to complete the balance. The second scenario is requested by the patient or the doctor who wrote the prescription. The deadline to fill the remaining balance in that scenario is the balance has to be filled within 30 days as opposed to 72 hours. In the third scenario, with a long-term care facility patient, resident, or a terminally ill patient, the deadline to fill the balance of the order is 60 days. How about emergency filling of a Schedule II drug? So generally, prescribers cannot call in prescriptions for a Schedule II drug. However, the DEA permits dispensing a Schedule II drug pursuant to an oral prescription if the drug's immediate administration is necessary to avoid patient harm, and there is no reasonable alternative. Central fill pharmacies are prohibited from preparing emergency fills for Schedule II drugs under any circumstance. If the pharmacist is not familiar with the doctor, they must make a good faith effort to determine that the oral prescription came from a DEA registered doctor. This can be done by calling the prescriber using their phone listed in the public directory. Not the number on the prescription. The pharmacist must reduce the prescription to writing immediately, and it must contain all the necessary information except for the doctor's signature, obviously. Criteria for dispensing pursuant to an oral Schedule II prescription order. Dispense the minimum necessary amount. We have to use professional judgment there. The prescriber must provide the original prescription within 7 days of oral authorization. So again, the prescriber must provide the original prescription within 7 days of oral authorization. The original can be written or electronic. Written prescriptions can be hand-delivered or mailed. They must be postmarked by the 7th day. The face of the original must include the statement, authorization for emergency dispensing, and the date of the oral prescription. The pharmacist must attach the written prescription to the emergency oral prescription. Electronic prescriptions must annotate the electronic prescription record with the emergency authorization and the date of the oral order. If the original prescription is not received, the pharmacist must report to the California Bureau of Narcotic Enforcement within 144 hours and must also report to the local DEA office.